Welcome to my YouTube channel. Our today's topic for discussion is understanding hypertriglyceridemia. Hypertriglyceridemia is a condition characterized by high levels of triglycerides in the blood. Here's a brief overview. History. The understanding of hypertriglyceridemia dates back to the early 20th century when researchers began to identify the role of lipids in cardiovascular disease. The Framingham Heart Study, initiated in 1948, contributed significantly to our understanding of hypertriglyceridemia's role as a risk factor for heart disease. Discovery research in the mid-20th century identified triglycerides as a significant component of the lipids associated with cardiovascular disease. Advances in lipid profiling techniques such as lipid chromatography and mass spectrometry have enabled more precise measurements of triglyceride levels and their impact on health. Interesting facts. Risk factor for cardiovascular disease. Hypertriglyceridemia is considered a risk factor for cardiovascular disease, alongside other lipid abnormalities like high LDL cholesterol and low HDL cholesterol. Genetic factors. Some cases of hypertriglyceridemia are due to genetic factors such as familial hypertriglyceridemia, which can lead to very high triglyceride levels. Dietary influence. Excessive intake of carbohydrates and fats, especially refined sugars and trans fats, can contribute to elevated triglyceride levels. Association with other conditions. Hypertriglyceridemia is often associated with obesity, type 2 diabetes, and metabolic syndrome. Symptoms. In many cases, hypertriglyceridemia doesn't cause noticeable symptoms but may manifest as pancreatitis, abdominal pain, or eruptive xanthomas skin lesions. Management typically involves lifestyle changes such as adopting a healthy diet and increasing physical activity, along with medication in severe cases. Regular monitoring of lipid levels is crucial for managing and preventing complications associated with hypertriglyceridemia. Now let's move to our topic. Clinical presentation. Elevated triglyceride levels. Hypertriglyceridemia is characterized by high levels of triglycerides in the blood, often exceeding 150 mg per deciliter mg, DL. Often asymptomatic. In many cases, individuals with mild to moderate hypertriglyceridemia may not experience any noticeable symptoms. Primary familial hypertriglyceridemia. Caused by genetic factors and often runs in families. It may manifest at an early age and be challenging to manage solely through lifestyle modifications. Secondary hypertriglyceridemia. Associated with other underlying conditions like obesity, poorly controlled diabetes, kidney disease, or hypothyroidism. Treating the underlying condition can help manage triglyceride levels. Risk factors. Obesity and overweight. Excess body weight, especially around the abdomen, can contribute to elevated triglyceride levels. Sedentary lifestyle. Lack of regular physical activity can adversely impact lipid metabolism and increase triglycerides. Family history of lipid disorders. Having close relatives with a history of hypertriglyceridemia or other lipid disorders may increase the risk. Diagnosis. Lipid profile blood test. A lipid profile measures various lipid levels in the blood, including triglycerides, cholesterol, and lipoproteins. Fasting required for accurate results. To obtain reliable triglyceride measurements, patients typically need to fast for 9 to 12 hours before the blood test. General management approach. Lifestyle modifications. In mild cases, lifestyle changes may be sufficient to manage hypertriglyceridemia. Diet changes. Reducing sugar, carbohydrates, and alcohol intake can help lower triglyceride levels. Emphasize a balanced diet with healthy fats and fiber-rich foods. Regular physical activity. Engaging in regular exercise can improve lipid metabolism and help lower triglycerides. Medication. If lifestyle modifications are insufficient, healthcare providers may prescribe medications like fibrates or omega-3 fatty acids to help manage triglyceride levels. Follow-up lipid profiles. Regular monitoring is crucial to assess the effectiveness of interventions and adjust the management plan as needed. Question from today's topic: what are the primary risk factors for hypertriglyceridemia? Option A, high protein intake. Option B, sedentary lifestyle. Option C, low-fat diet. Option D, decreased alcohol consumption.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.